I'm Dr. Warren with Vibrant Life Oklahoma, and today we're talking about Gardasil vaccinated patients. The vaccine's given as early as age 8, as late as 25. Unfortunately, from time to time, given the wrong immune response to it, the vaccine just goes wrong and the patient becomes very symptomatic. The symptoms are very wide-ranging, from passing out to having convulsions, throwing up, just becoming very weak and unable to exist in their normal daily activities. These girls will be kind of normal school, color guard, sports, and just over the months following, they find themselves, out of that whole lifestyle and losing weight. And I see patients that are no longer walking, who are in wheelchairs or being helped just in and out of bed by their family members, and at a certain point, that's when they start seeking treatment. So the families that I see, oftentimes when we walk in, the mom is emotionally just devastated. She made the best decision she could. She did what she was essentially told to do. The dad is a lot of times either not that well connected to it or a little bit angry that it's happened, and it's really upset the whole family dynamic. And of course the daughter is just really sad and unsure of what is going on, and is looking to anybody to help her at that point. So oftentimes these patients have been seen everywhere. They've been to the Carrick Brain Center in Dallas. They've been to the Cleveland Clinic up in Cleveland, Ohio. They've virtually been everywhere. They've spent thousands of dollars. Nothing essentially has been addressed, and at a certain point, they're told, hey, this is in your head. This is psychosomatic, or you're depressed, or it's anxiety. There are any number of things that occur. And that is the point that we start IV therapy with them. So when treating these patients, they're all very individuals, but I basically see these patients improving after about 2 weeks of treatment. They'll go from not being able to function in their normal life to getting up and moving around. There was a girl, one of the first girls I treated, I'll never forget, it was about 2 weeks after I started treating her. Her mom called me one day crying, and of course you never want those kind of calls, and she was upset. She was crying because the girl was outside walking around in the yard, and her mom thought she would never see that again. So it was really a happy moment, but it was kind of early on in treating these kind of cases, so I wasn't real sure what to make of it early. So when you start treating them, usually there's some real improvement after a couple weeks, and then as the months go on, they certainly improve further from there. It depends a little bit on how well they're able to hold to their diet, and they're able to comply with treatment, but they all improve dramatically after a couple weeks, a month, right in there. So for example, I had a girl who received her vaccination. Her second one, that's when her immune system really kicked up, and she became very symptomatic. Dropped out of school, spent 8 months or so just in bed, not getting up, not doing anything. And we started treating her. Today, she is back in high school. She had to repeat part of her senior season year, then enrolled in college. So she's in college, finishing her senior year, just back living life, working some, doing very well. So in treating these patients, we use IV therapy, typically vitamin C, high-dose vitamin C, glutathione, and some chelating agents. Within this vaccine, there is aluminum, so it's a neurotoxicity, and we end up with some inflammation of the brain. That's what causes the social changes, personality changes, headaches, passing out, and the patient ends up in a lot of pain. And so as they go through treatment, we're able to get control of their pain using some of these different IV therapies. So, I have a daughter. I can't imagine facing something like this on your own without there being any answers. So if this story is familiar, give us a call. We'd love to help you on this journey and restore your daughter's health.